My name is Alyssa Palazzo. I am the acquisitions editor at Oxford University Press for social work textbooks. And we're so happy to have you here with Kelly and Robin, who are two of my favorite authors, to talk about the challenges we're facing during field seminar, especially during this time of the pandemic and social upheaval and social distancing, and how that's affecting what's going on in our field seminar courses. So Kelly, you can just click the slide once through. So Robin is Dean of the School of Social Work at Monmouth University. She serves as a representative of the International Federation of Social Workers to the United Nations in New York City. She's also the chair of the International Committee of the National Association of Social Workers. Kelly is chair of and professor of social work at Delaware State University. She's worked as a child care worker, an administrator, and a private practitioner before entering social work education about 20 years ago. And she's written in a lot of different areas, such as social work education, as well as substance abuse and abuse. And they are the authors of Breaking Out of the Box, Adventure-Based Field Instruction, 4th edition. So thank you so much, Kelly and Robin, for agreeing to do this presentation today. I'm so excited to hear about everything related to field seminar.
Thanks, Alyssa.
Thanks a lot. So let me get started by telling you about how we came to the book Breaking Out of the Box, and then we'll go on further and talk a little bit about field challenges and get started that way. So Robin and I were both teaching field class at Monmouth University, where I started my career as an academic. And she was teaching it one way and I was teaching the other, and we both thought what we were doing was actually really interesting. So I went to observe some of Robin's classes. She came and observed mine, and we kind of blended what we were doing and talked further about what we wanted to do, and we thought we had a book idea or two. So you're looking at the 4th edition of our first idea, Breaking Out of the Box, but there's more to come in another book that we're thinking about right now. Robin, do you want to add anything at this point?
No, I think it was just, it was an interesting collaboration for both of us to do this in field. And I think if you've used Breaking Out of the Box, you know that it's, there's a lot of different kinds of exercises. The whole point Kelly was trying to do at that time was to show different concepts that come up in field and different concepts that come up in social work, and how we could illustrate them through some type of adventure-based exercise. And it was really very cool.
So we have had challenges in teaching field, and we're sure that you have as well. And we want to spend the time here talking about how we've addressed some of these challenges, some of the challenges we expected that happened, and some of the ones that we didn't expect would happen, and kind of plan from there. So we've had 4 different categories that we're using. The first one is about internship and supervisors. In March, I'm guessing that all of you did the same thing that everybody else in the world did, and we just shut our doors and sent the students home. But so did agencies. Agencies didn't know what to do. They didn't know, there wasn't a lot of testing readily available, and so internship sites kind of fell apart. The COA was very forgiving and got right on trying to do a reduced hours for the semester. And they've continued on through the fall and the spring semesters. But we had a real challenge about ways to make that successful for the students, especially the ones that were getting ready to graduate, who are panicking now that maybe they couldn't graduate. So our students were the second concern. Could they get to class? Did they have the resources and the bandwidth to be able to get on to classes online? Were they able to upload correctly if they weren't used to using some kind of learning management system? And were they having struggles of their own in terms of illnesses or family illnesses that caused the semester to even get worse for them? The faculty were another issue. Not everybody was well-versed in online learning. Not everybody was prepared to go out and do site visits or ready to have those kind of site visits. And then finding a time and a place for internship and the processing of all this were the challenges that we saw. Robin, do you want to add to any of those categories?
No, I think that's perfect.
This will be a good time to just mention that the handouts talk about ways that field has adapted and ways that you can help prepare the students better for going into field with COVID not ending. So internship sites, we're wondering, could they reopen? Some didn't. Some were allowed to reopen but not bring students in because it was too much of a risk or liability for the agency itself. Our good supervisors were stretched beyond belief in terms of what was being asked of them, just like our teachers were stressed beyond belief about what was being asked of them. And so we didn't know about, could things be accessible to students? Could we have consistent, regular, and fair supervision? Were students going to be asked to do things that were out of their capability because there was a need for that to happen? Did they find out that field supervisors quit or were fired or put on leave because of the COVID? So some agencies kept some people on, some agencies kept everybody on, but people were out because of family, and just like social work faculty, family issues came up, students, children's education, all of that was an issue. And so we had to come up with creative ideas on how people could finish their hours. So there was a lot of sharing on the BPD listserv about ways that people were creating those hours and filling those needs for students and for agencies. And supervisors were also sharing different ideas that could work in a variety of different agencies. And that was really helpful for us going forward to suggest ideas to other agencies. But we also know that we need to suggest ideas as well, because not everyone was well prepared to figure out what to do next. Robin, anything here you want to talk about? Because this is where you came up with the great ideas about assignments.
Right. So, fortunately in March, we were in pretty good shape with our students in terms of internship, because at Monmouth, we require more hours than are required by CSWE, both for the bachelor students as well as for the master's students. So when we were looking at pulling students out of field, we gave them a 2-week window to terminate with clients, come to some kind of closure at their field agency, and then try to go remote. We then ended up developing a number of policies for our students, for our field faculty, and for the field supervisors. We use Sonia, which is, as some of you might use, as a field placement software program. So in Sonia, we then put up a form about what students would be doing for remote work, so that we would know that. How many hours did they have left? We put up, some of the field education guideline that you see in the handout about hours and what to do and what to count as hours. And that's where this whole idea came up then for the safety modules. We ended up at the university having to develop a plan for our state about how we were going to continue education, and especially clinical education, whether it was in nursing, in social work, in the physician's assistant program, in our professional counseling program. And so we ended up developing we use eCampus, which is Desire to Learn, for our course management system. So on eCampus, we created a community for the professional counseling students and the social work students, and put these modules there. We actually ended up requiring students to do some modules around safety and COVID as a way to collect hours, and then put another bunch of modules up there for students and faculty to use, so that if students were getting behind either then or now, they would have resources to be able to help fulfill some field hours. So that was one thing that we did. But I think this whole pandemic has really caused us to think totally out of the box on everything. And so the other thing that we did, which we had been wanting to do for years at Monmouth, and Kelly will remember this because she was at Monmouth when we talked about this, was to have a clinic. So we always wanted to have a community clinic where our students could provide free counseling services. They'd be supervised by faculty or by other folks in the, social workers in the community. We never were able to do it until this moment. And one of our faculty, Dr. Ellie Maza, said one day in a meeting, we should just do a clinic, because we had mental health. We had 4th semester, final year MSW part-time students who needed their internship in the summer. And everything, if you remember, we closed down in March. Things sort of eased and eked into the end of the semester, but then we had summer classes, and these students needed a summer internship. It was their last one. So we developed a telehealth clinic as part of the, with the university, and it's been going strong. We're keeping it as a project within the School of Social Work, and as something that will continue so that we can have our students who are interested in learning how to do telehealth continue to do that as an internship. And we've expanded it beyond social work. Our professional counseling students are coming in January. We have a nursing student with us, and we're opening up to our occupational therapy students next year as well.
Robin, if I could just ask you a question. We have one coming in from the audience. How many hours worth of modules did you provide to students, and did that differ in the initial crisis last spring compared to what you're offering now via the module and offering them to complete?
I think it's more that we did now through the summer and then into the fall. As I said, most of our students were almost done with field hours when we pulled them out. We pulled them out by almost the end of March. So they really had only April, and they would really only had about 2 weeks left in our field timeline, because we have them try to end by the middle of April, their field hours. So most of them were done. We've really put these modules and these requirements together for both the summer internships and then into the fall. So, and back to you, Cal.
Sure. And on the other end, Delaware State only requires the minimum that CSW requires. And what I've been telling students there is that even if we are just at the minimum, 85% is not the goal for this semester. The goal is to get as many hours as possible, because we don't know what's coming in the spring. All the experts are warning that things are going to get far worse in the spring. So if students are at 85% now and they try to do 85% in the spring, they might get it all done. So what we've been encouraging students is to try to get as many hours this semester as possible, with the total being 85% in case we do have to close internships again come the spring. And we're all running thinking we are doing best, and we're going to learn at some point that there's better ideas out there, that we can do things just a little bit differently. It's going to make it easier for students as well as for supervisors and the faculty who are doing internship visits as well. So for students, we did have to make sure that they were prepared for field. And prepared didn't mean just will they follow the NASW Code of Ethics, and will they be appropriately distancing themselves from clients, but it was also about matching them up with the right internship. Internships changed, supervisors changed. Some people quit because they felt like it was safer to be at home with their family. And so we had to rearrange things as needed. We still had to talk about the importance of professionalism and making sure that we match the right people and how to dress right, and figuring out what issues still come up in field and learning the best way to handle all these things. So these things were in existence prior to COVID. All of those of you who are field supervisors, you're aware that you've always had to talk to students about ideas about how to dress, what to say, what not to say, how to be prepared for a meeting, looking as best as possible, not getting there 5 minutes after 9 and not trying to pull out the door at 5 minutes to 5. And so these things still need to be stressed and still need to be dealt with, and COVID didn't make that much of a difference in this area. So we needed to reinforce these ideas still in different ways, and getting an idea about how to appropriately dress, whether you're allowed to dress casually or dress down at your agency or dress professionally. And it's a challenge for people. And so at my school, we set up a closet for professional dress where some of the faculty and some of the supervisors have developed a closet where students can come and find professional dress that's acceptable. Robin, I know that you guys also do pictures to show students what to dress and what not to dress.
We have a Pinterest page for students, especially the students at the undergraduate level who are going into junior field, who may not have anything but their sweatpants and their sweatshirts and all of that. We've had the Pinterest page, and there's the School of Science often runs a professionalism workshop at some point in the semester, and last year they collaborated with one of the stores. I think it was JCPenney's in the mall, and Penny's brought clothes for students who needed to go out on internship, and they were selling them at a discount. And so, we have to get them prepared for that. But, now with COVID and with students working remotely, we also had to say to them, what does your space look like for you to be on screen if you're going to be working with clients, or if you're going to be, doing work remotely? Are you in a space that you can have a quiet space? Some of our students went home to families and all children then came home from wherever they were. Sometimes, so there were lots of people in the house, or there were animals, right? We all have animals that walk across our screen when we're teaching. So we had to talk to them about whether they had the space to do it, and whether they were able to have a private space or a closed space if they were going to be in more of a clinical site. So it was really interesting to begin to think about, it wasn't just the dress. Now we had to think about this environment that people will look at in the screen as well. And keeping cameras on, right? Keeping cameras on, how do you use them? How do you discreetly say, I have to close my camera for a second, or whatever. All interesting issues.
And I just want to clarify there, Robin mentioned junior internship. At Monmouth, there are 3 separate internships at the undergraduate level, 30 hours attached to human behavior, 100 hours attached to a practice 1, their first practice class, and then the 448 hours over the year for their seniors. And so Robin's just talking the internship right before their senior internship.
Thanks,
the other thing I wanted to mention is that we were fortunate at Delaware State in that we have instituted a iPad for every student program 2 years ago. So we were lucky that our students, most of them, 85% of them, had a instrument to use rather than their phone, but they didn't always have bandwidth, and they didn't always have enough service, and they didn't have Wi-Fi. So all these challenges were things that we had to think about for anything the students were doing to remote in, both for class and for internship.
Related to the remote stuff for class and internship, I have a lot of questions coming in from the audience about the telehealth clinic. So I'm just going to rattle off a few. They're all sort of around the same theme. The first is, how did you manage the compliance issues for the telehealth clinic? The second was, did you collaborate with a student counseling center or whatever entity is typically providing mental health services to students? And then the third question that came in with this was, for the telehealth services MSW students provided from the School of Social Work Counseling internship, what were the licensing requirements to make that possible? So that's a lot of questions, but if you could sort of generally answer.
Sure. I'll go over a couple of things, because when we first ran this by the university, there were 2 things we even had to check. We had to check our university charter to make sure that as a university we could offer a telehealth clinic. And according to our charter, because this was something that was going to benefit the education of students, we could do it. So that was the first one. Then we had to check the insurance. So the person who does all of the insurance for the university looked into what was being covered right now. And fortunately, we had the correct insurance for liability insurance for both the students, the faculty who are supervising. And I'm very fortunate that I have 4 dedicated clinical faculty who are supervising these students for free and doing all the work for this for free. And they would be covered, as well as any volunteers who were providing supervision. So for example, we have a couple of faculty who have retired, or who have were adjuncts for us and have retired and have the LCSW. They would be covered if they were providing supervision for the students. So that was the first piece of infrastructure. The second was that Ellie, who I mentioned before, is coordinating the work of the clinic. So she was looking at the various platforms to use, and we ended up landing on Thera platform because it is a HIPAA compliant platform rather than using Zoom or Google or any of those others. We started right from the beginning with using a HIPAA compliant platform. And so we use Thera platform. There's a monthly fee that we have to pay based on the number of students and clients that are, number of students that are providing counseling, and then the number of clients who are receiving service. Right now, that averages at about $300 or so a month. And then finally,
Robin, let me ask you a question before you go further. You are seeing people who are not students at the university. You're talking about community people, correct?
Yep, community. That was the third thing I was just going to mention was that when we started it, we were very clear because we have a robust counseling services department at Monmouth, and we didn't want to interfere with what they were doing. So the telehealth clinic that we're running, it's called the Monmouth Unit, and you can Google this and you'll find the website and see what it looks like. It's the Monmouth University Community Care Telehealth Clinic, and it serves people 18 and over. We did not do anything with children because that would be another compliance issue. So it's 18 and older adults anywhere in the state of New Jersey, anywhere in the United States, basically, because it's telehealth. And anyone can call in. And so we're not seeing any of the employees of Monmouth University or any of the students. It's really for the community. So good questions.
Alyssa, okay to go forward?
Yes, please keep going.
Sure. Okay, so our next area was faculty. And we don't have to tell you this, we've been overloaded, and staying at home at the beginning sounded like a great idea because you have less commute time. You could be at home and run around and do errands in between meetings. But it seemed like meetings took over for everybody. So when people were not teaching synchronously, they were busy in meetings. And so time quickly got away from everybody, but being able to make sure that we could connect with the supervisors, making sure the students got what they needed in internship had to become a priority for all faculty. So if you were talking in a practice class about what was happening in internship and it seemed like things weren't going well, the faculty really need to reach out to the director of field. And the faculty needed to get involved if they needed more information or if they needed assistance to take care of everything. We also have to make sure that we felt like people were ready. So at my institution, we were just starting placing students for fall in March when spring break occurred. And so we didn't know all those students very well, and we weren't sure about their readiness, and we weren't done with the semester yet. So making time to get to know the students and making sure that it's an appropriate placement and making sure that the faculty had time to do the field visits. Although they were remote, they still were important to do and they couldn't be ignored. And again, this became an issue in terms of ability. Not all internships have internet. Not all of them have the capability to share more than one screen at the same time. And so trying to figure out how to talk with supervisors and students during site visits was another area that we just had to tackle, make sure things went well. Robin, anything else you want to add there?
Yeah, I think, the Zoom fatigue is a real thing. But the other piece that you were mentioning, Kelly, when you talked about having started to place people already for fall back in March and April, we were doing the same thing. And there were many people, many agencies that thought, oh, by the fall, I should be fine. I can take a student, I can take 2 students. And then we crept into August, and then we started to get calls, and I'm sure you all have. This happened to you. We got calls from agencies saying, you know what, I said I was going to take 2 students, I can't take anybody, or I can only take 1, or we're not sure. We're not even sure in August if we can do it in September. So there was a lot of upheaval. Our assistant field director, Sarah Brown, did a magnificent job in just managing and juggling all of the placements, the student concerns, who was coming, who was going, what was happening, what was not happening. So it made us then rethink again about our internships and where we needed to place students. So we're also fortunate in that we have a number of projects that the School of Social Work at Monmouth runs. We have a community garden, we have a veterans project, we have a suicide prevention project, we have an LGBTQ older adults project. So we went to the people who are running all of these projects at the school and said, can you take a student? Do you think you'd have space for a student to do some work with you? And, again, looking at what the school was doing, did we need some grant writing? We could take maybe a BSW student for the fall who would work with me on grant writing. Anything that we could come up with, we were doing just to be able to make sure the students could still be in field and get field hours that were appropriate. Again, you brought this up before, Kelly. We just in normal times, we're looking to make sure that the field agency can give appropriate work to the level of student that they're taking. This made it even more complicated with COVID, so that we didn't want students doing busy work. They had to learn something, right? They have to learn in going along with what they're learning in school. And so trying to make sure that they also had a relevant field internship meant many more Zoom calls or many more outreaches to folks. We put a Facebook notice out to our alumni. If you need an intern, if you think you can have an intern remote, let us know. We just did everything we could possibly do.
And we did the same. We have interns working on grants with the faculty received. There's a student working in the office with me. Sometimes they get to do jobs that they weren't planning on. So we were unfortunate in that our office manager had taken a new position on campus in March, and we weren't able to fill her spot because of hiring freezes. And so I was left to do a lot of budgeting work and a lot of paperwork that needed to get done, because that's what you do, just like in social work agencies. And so I had my student helping me make book orders out for the semester. Not something a normal social work student might be doing, but it was certainly something I was doing, and so she assisted with that. We also have launched as many as possible continuing education programs that can be virtual, and the students were helping organize and arrange those, developing certificates, all things that were important for us, but that they were having opportunity to learn as well. So the other things that we've talked about today are really related to all field issues, making sure that they're appropriate, making sure that students are getting appropriate work, supervision is good, site visits can happen, learning agreements are up to date and current, and teaching about the competencies. But then you add the pandemic. But the pandemic aren't the only issues. We can have natural disasters. Robin and I worked at Monmouth when Superstorm Sandy came into New Jersey. My town was impacted tremendously. There was 1,200 houses in my town, and 85% of them were uninhabitable for almost 3 years. And so there was a whole idea of being able to do social work internships in the communities that were similar to mine that needed a lot of help. So students were in their communities, they couldn't get to their internships, they had no electricity, but we made Monmouth University a shelter. So we had 1,000 people living at university's gym for a while, gym/auditorium. But we also had students helping up their neighborhoods. And so they were helping take water out of people's basements, helping people take out their belongings that they were not going to be able to, what they could salvage, what they couldn't. And so incorporating those kinds of ideas, you need to be flexible in internships to be able to handle those. We also added contagious illnesses, lice, chickenpox, etc. If you're working with a population that has low immune systems, like people with HIV or AIDS, it would be a real problem if some kind of illness broke out at an agency. And so you need to be prepared for contingencies around this, for your students, for your clients, for the faculty. Can we handle all these kinds of strange things that might come up during the course of internship, because now they're even more strange and more individualized than we ever had before. Robin, any thoughts?
Yeah, I'll go back to the Superstorm Sandy time, because of Superstorm Sandy, like we'd never had an outage like that at the university where we were out totally it was a couple of weeks. Mm-hmm. We didn't have an emergency plan specifically. We made one up at the moment, right? Like a chain tree, who was calling who, and then who, and then who, and then how we were making decisions about classes and students and field and all of that. So we, post Sandy, developed one, but as we were entering into COVID, we took that out again and refurbished it and retweaked it and did a little bit more with it. So if you don't have an emergency plan, think about developing one now, just for whatever comes your way the next time something rolls around, because you never know when it will, and you need to have some type of action about how classes will go forward, how field will go forward, how communication continues, et cetera, et cetera.
So again, just to summarize, these are the things that we find to be challenges for us, and we assume for everyone else that's on the call today. matching the right internships, making sure it's a good match, monitoring the professionalism, assuring student readiness, appropriate dress and transportation, students' own issues getting in the way and surfacing in the internship, making sure you have good supervision and you've got field visits to take care of. I want to just add here, because we have a internship issue right now that we're dealing with. We put 3 students in a startup agency that was ready to set to go in July, but opened up in October instead, but they did a lot of the pre-work. You know, sometimes, although agencies know what they need, they don't always know how to give direction. And at the startup agency especially, there becomes lots of things that need to be done, but not time to take time to teach a student. And so people have to really gauge what's going on in their agency. If there's a launching of a new program, if there's a closing of a particular part of the program, is it really the right place for an intern at that time? It's exciting if the intern can hang on, but sometimes it's a real struggle to keep the intern up to date with all the changes that are happening.
That's a good point. I'm sure, you know, there are lots of us that have students in agencies, small agencies, where the students are basically the employees of the agency. You know, the agencies run on our student internships, whether it's undergraduate or graduate. And they're wonderful in many ways because they get a lot of responsibility often, but there can be lines blurred in those places too. And sometimes, you know, we have to just be very careful that we're making sure that the student is still getting the supervision and knowing what to do and what not to do, because they are a semi-employee, but they're really not. And so it becomes an interesting thing to think about.
And that's true even if they're lucky enough to have gotten a paid internship. So even though they might be getting paid, there's still a requirement for the supervision and the site visit that need to happen. So we are open for questions. This is not one of our dogs, and none of us are caring for this dog at the moment, but we do believe he's cute.
I personally am a huge fan of dogs. So we have a lot of different questions coming in. And just to reiterate to the audience, you know, everyone's on auto mute, but you could just go to that question box and then type in any question you want to ask. There's no parameters here. So I'm just going to pick one to start. So we had been talking a little bit about the students, you know, working on campus with various projects like the community garden, the student services, the grant writing. Who is providing, you know, field instruction and field supervision to those students who are working on campus and not with the agencies necessarily?
So that's the faculty member who has that project. So I'm supervising the student who is doing the work in our social work main office. And we have an hour of supervision a week. And I give her a lot of information about backstories about how we got to this place where we are and why we're trying to solve things, which gives her context to be able to understand the other side of education that doesn't have anything to do with being a student.
Yeah, same for us. We have faculty who teach the field seminar course, and then other people, other faculty or other adjunct faculty or other community people are supervising the students in these projects. So for example, the community garden, I supervise the person in the community garden. Our veterans project is our veterans coordinator on campus, who's one of our MSW alumni, but he helps me with our veterans project. He's the one who supervises those students. So there is a clear distinction between the person who's teaching the field class and who's supervising them, and they are all MSWs with their license.
So another question we have is, do you require students to take a strengths finder assessment to assist them with their placement? And do you also have an assessment that you use to assure the student their readiness for the position?
So for me, in our application process, we ask a lot of questions to students that we go over during their interview to get into their internships. And so that's one way, is that one-on-one exchange with the field director and the student. We don't have any formal assessments, but the open-ended questions that are on the application can prompt some discussions to figure out where things are going. There's also a scale that we ask the students to do when they apply to the major as BSWs that they have to go over with their advisor that talks about some of the areas around professionalism and how do the students rate themselves, and their advisor signs off on that.
We have something similar. We don't use an assessment. Our field office begins working with students in their junior year, and their application to field comes in between sophomore and junior year, and that's the application to the major. And it has a number of questions on it that they have to answer. Again, providing their resume, and then it's an interview with the field office, and their application actually has to have either their advisor or one of their faculty sign off on, which specifically asks about their readiness to go into field. And we start at the junior level, so they have readiness for junior. Then when they get in senior, it's updated to readiness for senior, and we go forward there. We also have a student review policy, which Kelly wrote many moons ago at Monmouth, which is also a way for us to make sure that students are ready to continue to go through the curriculum and go through the program, whether at the undergraduate or graduate level. And it's a whole process that allows a referral to a committee, a non-partisan, you could say, committee of faculty who have not teaching the student. If there's an issue around professionalism or ethics, or just their curricular issues, not doing well in school, not being there, not coming in, we can refer to the committee, and the student has a voice at the committee. They get to present their side of the story. The faculty ask questions, and then they deliberate and come up with some type of a plan for the student. So it's another way for us to be able to halt a student if they're not ready. If we thought they were, because many times we think students are ready, and then they get into their field internship and they're not ready. And field is the kicker. Field is usually the kicker. It's what either makes or breaks the student. And we've all had students who are, excellent academically, and then they get into field and they flounder, or they're so academically, but they flourish in field, so it's going to be the catalyst for us to know what's really going on.
Yeah. So this next question comes from an instructor who's been trying to find a balance between passive or fill-in learning, like watching webinars or completing online trainings, and more typical field work where the students engaged with their agency. And have you thought about how exactly you can strike that balance to make sure that the students prepared upon graduation to effectively serve their clients?
I think that's a really good question. I think we are all figuring the answer to that out as we go forward, because we don't all have a best answer. We don't know what the students who finished their internships look like that graduated in May of last year. And we don't know what this year's groups are going to look like and what we could have done differently and better to prepare. So I'm relying on people, the supervisors who are now hiring graduates, to let me know what they are not good at and how we can do differently. So we have not implemented yet, but we need to talk about getting more firsthand experience with doing assessments and interventions. And so if that's more role play in class, if that's more talk about how to do things virtually with the clients, then we have to figure that out. So I don't have an answer for that one yet for our school. I'm not sure, Robin, what you've got going on in that regard.
It's really the same. I think you put it well, Kelly, when you said we're all figuring it out, because we're all figuring it out. I think we are using the webinar modules as backup. So we're trying to get the field faculty, I know, are trying to work with the students to make sure that they are just getting as much as possible out of their field agencies as they can, within reason, in terms of what the field agency is able to do as well. And then the modules are there for additional backup in terms of hours, because everyone's stressed. Everyone's very, very stressed about getting their hours, being able to pass, being able to get that job. And so we've been trying to just scour every kind of opportunity. And in talking to students about advocating for themselves at the agency, to talk about opportunities that they can do or that they can be a part of that maybe they weren't thinking about, but it's another thing that they can see and they can participate in that might give them, again, a little bit more to add to their skill set.
And for me as a faculty member, I've said this forever, and I think that this is true for most of us, that the end goal here is that our clients get served. And so teaching our students to do something so that they can benefit our clients is important. So we have to make sure that we feel like our students are prepared and that we prepare them based upon what's going on in our environment now. And some of them might not be as prepared as we think they're going to be, but we know that they're going to be okay. And the other ones that aren't, we need to give them that support, because our end run as social workers and social work faculty is that the clients are not harmed, but that they are benefited by every exchange that they have with a social worker or an agency.
That's a great answer. This next question is, we've been increasing our reliance on external field instructors, as this has allowed us to find more placements, without a social worker on staff. Do you use this model, and have you found any good strategies for supporting external field instructors who are not tied directly to the agency?
We use that at Delaware State, and we offer free CEUs for the external supervisor. And so we try to work out a plan that's going to incorporate them getting something free back from us, but also working with flexibility in terms of what they might have going on in their agency. So flexibility in supervision, flexibility in what projects they can give. So that's all been something we've been taking care of in that regard.
Yeah, we make sure, because we do the same thing. We have agencies where there's a task supervisor who's, really making the student work, every week, and then the outside MSW supervisor. And we try as many times as possible to find that person in the agency somewhere, even if it's on the board of directors. And then, because then they have a connection to the agency. If that's not possible and they're outside the agency, we make sure that they know who their agency task supervisor is and that they, communicate and talk to each other. But we also incorporate them into everything we do for our field supervisors. So they come to the field orientation in the fall. They're invited to the field breakfast that we usually had in the spring. Any communication we're doing around field, they get that. So we try to make sure that they, just are part of that team.
So this instructor has written in, and they say that in the program that she's affiliated with, she has a director of field, along with a field seminar instructor, and then a field liaison. And she says there are benefits and challenges to this structure, and she wonders if you have any thoughts on the structure and whether or not it works well. And again,
a field liaison model. So we have seminars for field courses, both undergraduate and graduate, with a faculty member who teaches them. We try as many times to have a full-time faculty member, but we also do have adjuncts who teach our field seminar classes, especially at the graduate level. And they are the ones who go out to do site visits. And they are the ones who then are working with the assistant directors of field. We have 2 assistant directors of field. If there's a challenge in the internship, or if something comes up, they're tied to them. We've just never used the liaison model ever at Monmouth, because we've just felt that it was a third person going in who didn't have that connection to the classroom and didn't really know what was going on. So your field faculty, they're teaching, they see what's going on in the classroom. Then when they go to the field site and they're hearing what's going on, or they're reading their journals, they have a much better whole-rounded picture on that.
And Delaware State had a liaison model when I came, and when we changed, we had a new director of field. We created a new model that's similar to Monmouth's. I spent 25 years at Monmouth, so a lot of my foundation about teaching comes from there. And I find that the students talk about things in internship class and in seminar that don't get expressed in journals. And so we don't have the liaisons any longer. And we're having a good experience with that so far, but we are only in our first semester of that right now.
So this next question goes back to the telehealth clinic we were talking about earlier in the presentation. And this instructor would like to know, for the telehealth clinic, were you billing the insurance for clients, or was the service you're providing completely free?
Completely free. It's completely free. And we did that at this point because we were in COVID and we were feeling like there were a lot of people in the community who just needed somebody to talk to. And what's interesting is the first few clients that came into the clinic were teachers or social workers who were just overwhelmed, you know. And what's happened now is that there's our community college near us, Brookdale Community College, no longer has any mental health counselors. And so the college is referring their students to our telehealth clinic because they don't have that ability. And we just had the animal hospital in Red Bank start an affiliation with the clinic so that there are a couple of our student interns available on the various shifts for the animal clinic. This is a 79 physician, 300 employee, large animal hospital in Red Bank, New Jersey. And their physicians and staff were incredibly stressed and overwhelmed with everything going on and all that they were doing. And so now they're working shifts, and eventually next year they want to have a person at the clinic, a clinical student at the clinic every day, every day that they can be there as part of their internship. So it's been working pretty well so far. Touch wood.
That's an amazing program. Next, we have a few questions about your field seminars at Delaware and Monmouth. The first one is, what student body size does each program have? And the second question is, at the graduate level, is the seminar weekly?
So Monmouth and Delaware State are about the same size. We are in between 5,000 and 6,000 full-time undergrads. And we meet weekly at the undergraduate level. At the graduate level, we meet every other week. And that was more about division of labor with the faculty than it was about the students' needs. The students probably would enjoy going to field every week to talk about their issues. And our class capacity for field is between 12 and 15, depending on which program you're in.
Right, very similar. Our undergraduates, the seniors, are in a 2-hour and 45-minute field seminar class every week, and it's worth 6 credits. And so it's also worth 6 credits of teaching for the faculty member who's teaching that load. And at the graduate level, they actually meet weekly for an hour and, I want to say, hour and 20 minutes.
Yep.
And again, our both field seminar classes for undergraduate and grad are capped at 15 students.
So next, due to the current social climate we're in, would you be willing to speak to how you both are preparing your students to practice, anti-racism at their field seminar placements or out in the field, after they graduate?
Good question. So Delaware State University is a historically Black college or university, an HBCU, and we pride ourselves on being the most diverse HBCU in the country. We also have the only social work program in the state of Delaware. So if you would like to be a social worker and take advantage of state tuition, you need to come to Delaware State. So we are talking about race all the time. We are talking about the every incidence of bias that comes up, and we're talking about what it looks like based upon the population that's in the classroom at the time we're having the discussion. Sometimes I am the only white person in the room. Other times I am the oldest or the youngest, and we've got just a mix of everyone possible between our BSW and our MSW program. And we have to be honest about these issues to prepare students to the best of our ability and to let people be prepared for the topic.
Yeah, agreed. We've been teaching for a while all the issues that come up with race and critical race theory and others, but it was probably after Michael Brown's death in Ferguson that we, as a school, formed a committee called Growing Together as Allies. And it's a faculty-led committee that meets once a month to go over everything that comes up in the classroom, resources that should be used, how to change the curriculum, everything. So that committee has been going on for a while. When did we do this? This summer, this August, the school purchased for all of the faculty who wanted it, the Me and White Supremacy book by Layla Saad. And we have a new diversity director of our intercultural center at Monmouth, and she and one of our faculty helped the group process that book over the course of a month. I didn't participate. I wanted them to do this on their own. And since that, the Growing Together as Allies committee has become a permanent formal committee with particular specific people always on it, and then others can join. And they're continually looking at the curriculum, on what we're teaching, on what we're doing, on how we're supporting students, and really taking a deep dive into everything right now, from our job ads to policies to curriculum to supporting students. And Monmouth itself has, the president had a note out to all of the universities sometime in, I was going to say September, October, about becoming an anti-racist university. And so at the university level, there are other things that are going on to try to fulfill that commitment as well.
So this question's a little bit tied to the previous one. Have you heard any conversations about retiring the term field because of the negative historical connection to field work, with slavery, or current connections to immigrant populations doing field work?
That's an interesting question.
Yeah, I had not thought about that before.
No, I hadn't either. Sometimes, and we go back and forth sometimes with saying practicum, internship, and not saying field, but it's an interesting thing to really think about. I know when we were writing this document for the state, we were talking about this, to be able to continue the internships for all of the different groups. We're talking about as clinical sites or clinical placements. So maybe we do need to retire the word field. It's a good question.
I think we have time for one more question before we wrap up. Your undergraduate field seminar courses, how many students do you have in your field seminar courses on average based on the number of sections, and what's your cap per section?
Yeah, the cap per section for us is 15.
Mm-hmm. And that can be plus or minus depending on the size of the senior class. So this year we have, I think, 49. It didn't seem practical to do anything but divide those other 4 up between the other 3 internships rather than start something new or to make them smaller. So I think we're now got 2 sections of 16 and 1 section of 17 right now, but we strive for 15.
Yeah. Okay, so I think we have actually made it to everyone's questions. If it turns out there's an additional question that someone still wants to ask, just send it in and I can have Robin and Kelly answer it offline and we can email out the answer. I also want to remind people that this presentation was recorded and it is going to be available on the OUP USA website. We're going to send out an email to all the attendees and all the people who signed up with a link to the video, the slides, the handouts in case you forget to download them, and that'll probably go out in a few days. I also want to remind people that Kelly and Robin's book, Breaking Out of the Box, is available for examination copies if you're an instructor, teaching field seminar, you're a director. And that can be found on our OUP USA website. All you got to do is click the request examination copy button, or you can write to me. I'm more than happy to help you. We also have some phenomenal instructor resources that were created by the authors. They're available on Oxford Learning Link at www.oup.com/ward4E. And they include PowerPoint lecture outlines, an instructor's manual that has classroom activities for you to take advantage of. There are cases with additional questions. And those materials are free to anyone, regardless of whether or not you adopted, Kelly and Robin's book. So thank you again. Thank you, Robin, and thank you, Kelly, for leading this great presentation. You guys talked about such cool topics and answered so many questions, and we're so grateful. And thank you to everyone who attended. I hope you enjoyed the presentation.
Thank you.
Thank you very much.
Everyone who came.
All right, bye, everyone.